So in our earlier class we have seen various important concepts. One, we have seen that in case of epilepsy there is a asynchronous and rapid firing of impulses. Most of them are not desired and therefore we need to control this. We have seen by mechanism there are two important mechanisms, that is, one is either make it IPSP, that is make the inhibitory postsynaptic impulses or potential, and reduce excitatory type of postsynaptic potential. So these are important ways. This can be achieved by various ways, either by sodium channel, calcium channels, glutamate. We have seen all these mechanisms earlier, basic mechanisms and the drugs which are there. Then we have seen very important pharmacokinetics concept, that is all the drugs which has to be which has to show any action on any case of CNS. The very important thing is they should cross blood-brain barrier. For crossing blood-brain barrier, they should have very good lipid solubility. So this very important aspect we have seen. When most of the drug which can cross blood-brain barrier, they can even cross the GI barrier, and therefore they can be most of the drug can be easily administered orally. A very simple logic is there. Second thing is, we have seen that how the drugs are metabolized. Wherever there are certain drugs, example barbiturates, they can cause enzyme induction, or there are certain drugs which can cause enzyme inhibition, and what can be the consequences of that. We have seen it in earlier class. Now next or last one, we will go for again various drugs. What are their uses, in what condition they are used, and what are their important adverse effects, that we should have a quick this one view about it. So we have seen various drugs. So first class of the drug we can have again sodium channel modulators, which are acting on the fast inactivating channels. Again, this all fast inactivating, slow inactivating, I repeat, we have seen it during arrhythmia also. So these are example of this is phenytoin. Phenytoin is used in case of focal type of epilepsy, and it is also used in a generalized tonic-clonic seizures. In both cases it is used. Now it can be given in the patient who are aware about it, or those which are having impaired awareness. In both cases it can be given, which are having awareness. They can understand. Impaired awareness means there is a big problem related to the CNS functions, and even cognition is affected. So awareness is decreased. Now what are the important clinical aspects of this? One, we can give once a daily dosing using extended release formulation. Intravenous use can be possible if it is we are using its analog, that is fosphenytoin. The pharmacokinetics is not linear. Not linear means it is haphazard. All of a sudden concentration can increase or decrease. Then it may interfere with the drugs which are metabolized by CYP2C9 and 2C19. So this is important. It causes induction of CYP3A4. So any drug which is metabolized through CYP3A4, this phenytoin will causing increase in the metabolism of this drug, and therefore we have to increase the dosing or concentration. And if it is interfering with the drugs which are metabolized by CYP2C9 or 2C19, then their metabolism is decreasing. So these are very prone to have drug-drug or pharmacokinetics, we can say drug-drug interaction, or metabolism related drug-drug interactions. Carbamazepine can also be used in focal, where either patient are aware, they are not having any impairment, or they can be used with the impairment in the awareness. It can be used in the focal to bilateral tonic-clonic and generalized this tonic-clonic seizures. This is also causing induction of the enzyme like CYP2C, CYP3, and this urinyl glucose transferase, that is which causes glucuronidation or phase 2 reaction. The active metabolite is 10-11 epoxyite. The side effects, I'm sorry, I forgot about side effects, that is phenytoin. Phenytoin is having important side effects are gingival hyperplasia. Gingiva, that is, gums, we call them, teeth gums, and hyperplasia, that is increase in the tissue formation. So there is a gingival hyperplasia, facial coarsening, then hypersensitivity, that is allergic reactions which are rare. Then next is this carbamazepine is having side effects like drowsiness. Drowsiness means feeling sleepy. जो क्लास में बहुत सारे बच्चे होते हैं, खाना खाने के बाद टीचर क्या बोल रहा है ध्यान में नहीं आता, नींद आती है, we call them as a drowsy. So drowsiness, vertigo, चक्कर आने जैसा, ataxia, that is muscle coordination ठीक से नहीं रहता है, blurred vision, सामने वाला धुंधला दिखता है, like that. Increase in the seizure frequency, so it may increase the frequency of, maybe it will reduce the what we can say potency of seizure or the impact of seizure, but number of seizure initially at least it can increase. Then eslicarbazepine, it's analog of carbamazepine. It can be used in focal seizure, either patient is aware or having impaired awareness. Then next is lamotrigine. It is used in many conditions like focal seizures, whether patient is aware or even without good awareness. It is also used in generalized seizures like absence seizures and tonic-clonic seizures. The half-life of lamotrigine is reduced in the presence of phenytoin, carbamazepine or phenobarbital. Why it is reduced? Because these drugs are having interaction for metabolism, so same metabolism pathway is there. The concentration will be increased in the presence of valproate, because valproate causes the competition at same site. I'm sorry, phenytoin, carbamazepine, phenobarbital will cause enzyme induction, and therefore the half-life will be reduced. It can also be used in a Lennox-Gastaut syndrome. It is sort of this partial epilepsy, and it is used in that. Then next is oxcarbamazepine, that is which is used in focal type or oxcarbazepine. It is same as carbamazepine or eslicarbazepine. Even whatsoever adverse effect and all these are they are similar. This is a prodrug. It is metabolized to eslicarbazepine. You can see above eslicarbazepine is a blank because it is same. This is a prodrug and that is converted, or it is metabolized to eslicarbazepine. It has got sharp half-life. Oxcarbazepine is. It is less potent enzyme induction as compared to carbamazepine. Side effects are lower incidences of hypersensitivity reaction as compared to carbamazepine. So these are the newer analog which are used. See, carbamazepine was the first, then oxcarbazepine was its analog, and esli is the newest one of these. So you can compare all this and you can understand that this is a prodrug which is metabolized to eslicarbazepine. So similar action these both will show in. Then rufinamide, that is also used in focal seizures where it may be focal seizure having symptoms of good awareness or impairment of awareness, and it can also be used in a Lennox-Gastaut syndrome. Then next is the drugs which are modulating sodium channel, but it enhances the slow activation. We have seen this is a fast activation enhancers. So this is slow inactivation enhancers. Example of this is a lancosamide. This is useful in the focal one where the problem is awareness and impairment awareness. In both cases it is there. Then calcium channel blockers, which causes blockage of T type of calcium channels. Example of these are ethosuximide and zonisamide. Ethosuximide is a drug of choice for generalized seizure having absence seizures. Just we have seen it, the sign symptom, that is staring like phenomena, only staring like or not having any kind of attention. The side effects are GI complaint, gastrointestinal upset, drowsiness, lethargy, dizziness, headache, hypersensitivity, skin reactions, we can titrate the dose. Here titration means it is not the titration you study in pharmaceutical analysis or something, acid and base. Here titration means dose titration. So dose titration means what happens? Always this word will come, the dose titration. Dose titration means what? Slowly it is checked that what you want to do. Suppose you want to reduce the number of epilepsies. So if you reduce it in that particular manner, and while reducing it you might have used very high dose, and therefore toxicity is there. So you gradually decrease it down, where you get the reduction in the side effect and efficacy is maintained. Same number of seizure. अगर एक वीक में 3 सीजर्स आते थे, and with treatment then you get it that you want to make it once in a month type of seizure maximum, you say that it is acceptable. Then if you get it that, and then your dose is whatsoever adverse effect it is causing, you slowly reduce it. So what is your end point? End point is you are having only 1 seizure per month is your end point. Just like in titration you are having end point, that is this phenolphthalein color change is your end point. So similarly our end point here is what? We are reducing the dose up to what extent? When earlier also we wanted instead of 3 per week there should be only 1 per month. So when we achieve this 1 per month at whatsoever lowest possible dose, that we will call as a titration of the dose. So with titration we can reduce the side effect occurrence. Zonisamide can also is used in case of focal epilepsies, whether there is awareness or there is impairment in awareness. Side effects are somnolence, ataxia, anorexia, fatigue. Then we have another calcium channel modulator which is acting on alpha 2D ligands. So example of these are gabapentin and pregabalin. They are also acting through GABAergic mechanism. Both are useful in focal epilepsies, that is having either awareness or impaired awareness. The adverse effect of these are somnolence, dizziness, ataxia, fatigues. Both are almost same. Both are having dizziness and somnolence. Then the pharmacokinetics of pregabalin is a linear, means as you increase the dose, the plasma concentration will increase. There are low potential for drug-drug interaction because it does not cause any kind of enzyme induction or enzyme inhibition. Then next is the drug which are causing enhancement of the GABA, that is which are causing GABA A receptor allosteric modulators. So the example of these are benzodiazepine, barbiturates. We have seen it mechanism wise. So GABA receptor is there, where 3 type of drug they can act. One is GABA agonist themselves, the drug itself GABA and agonist of GABA, or drug which are forming GABA is one. Second thing, the drug which are acting are benzodiazepine, which are acting on allosteric site, that is different than GABA, different than barbiturate, therefore we call it as allosteric site. Then barbiturates, they are acting again on different site, which is not benzodiazepine site or not as a GABA site. But all these 3 causes increasing in the GABAergic transmission, and when there is a GABAergic transmission there is an increase in the chloride ions passage, and because of chloride ion passage there is a more negative potential inside, or we call it as a increase in the resting membrane potential, which causes more time or more impulses to reach to the threshold potential. Example of these are clonazepam, clovazepam and many more, we shall see them. They are used in various kind of epilepsies like generalized epilepsy. Example of it is absence or myoclonic type of epilepsy. Side effects are drowsiness, lethargy, behavioral disturbances, and abrupt withdrawal can cause seizures. So in many conditions this has to be again maintained, this has to be seen that no drug should be abruptly withdrawn. Tolerance to the anti-seizure effects, that is this myoclonic will cause tolerance to the anti-seizure effect. Then Lennox-Gastaut syndrome, that is in that case clobazepam is used. It is one of the important drug. We have seen earlier also there are 2-3 drugs are there which are used in case of Lennox-Gastaut syndrome. If you remember, just now we have seen, that is rufinamide we have seen, then we have seen one more, that is lamotrigine. So these both are used in that. Similarly, this is clobazam is used in that. It's N-desmethylclobazam. Its active metabolite is increased in the patient with having CYP2C19 problems, where this enzyme is a different structure and having less metabolic capacity. Side effect same again, somnolence, sedation it is causing. Withdrawal should be tapered in both cases. Then next are the drug which are used in this, are drug which are acting through GABA again. They are GABA receptor allosteric modulators, just like we have seen earlier. We have seen some of the benzodiazepines. One more benzodiazepine is a diazepam. It is a drug of choice in a situation we call it as a status epilepticus. Status epilepticus, if you remember status asthmatics, similarly it is there. That is, status epilepticus is a condition where it is a sudden acute attack of epilepsy, and it is difficult to be treated with the current treatment, and therefore you need some treatment which can immediately control it, because it can be very dangerous and very severe as well. So in that, diazepam is a drug of choice, because as we have seen that most of the time they are refractory to the normal. Refractory to treatment is very important word again. Refractory means there is a no response of the treatment. The treatment do not show any benefit. So we call it as it becomes refractory to the treatment. I hope you understand, because you must have read many times refractory word in impulses. So same meaning we have to calculate, we have to consider. That is, we say that refractory period is the period where no impulse can be conducted. Here the refractory to the treatment, that means no effect, no beneficial effects are found. That means it is that drug is refractory, the treatment, the disease is refractory, or okay. So this diazepam is a short duration of action, and in since many drugs are refractory in status epilepticus, we are using. Then side effects are drowsiness, lethargy, behavioral disturbances. Again here we should not go for abrupt withdrawal, because it can again causes increase in the seizures after that. The tolerance to anti-seizure effect is developed. You know the term tolerance. Tolerance means after some time with same dose there won't be any effect of that, okay. Or we just now use the word refractory. So tolerance means initially there was refractory, means no response at all. Tolerance means earlier it was giving response, but now gradually you have to increase the dose, and for getting same one at certain period of time you get that you have increased the dose so much that now it is a problem of adverse effects, and you cannot go beyond that. So you have to switch from one drug to other. That is called as a tolerance. Phenobarbital is the barbiturate. It is one of the very important barbiturate, and very important in the treatment of seizures. It is useful in the focal seizure, that is focal to bilateral tonic-clonic and generalized tonic-clonic. In both cases it is used. It causes, yes, phenobarbital we have seen earlier also. It causes induction of enzymes like CYP3A4 and uranyl glucuronidase transferase. So because of this glucuronide transferases, glucuronidation can be faster, and therefore they causes increase in the enzymatic or catalytic activity for many drug metabolism, and therefore the plasma concentration of these drugs will fall down. Side effects like sedation, nystagmus. Nystagmus means eyeballs are rotating. Ataxia is a muscle coordination, irritability, hyperactivity and agitation, confusion, allergy, hypersensitivity reactions can be there. This type of adverse effects can be seen with the phenobarbital. One more important problem always happens with the phenobarbital or barbiturates is they can have the respiratory depression, and that will usually dose dependent. As the dose increases, more respiratory depression can be there, and many times they are also used as a sedative. So what happens is when they are used, we shall see it in more detail when we shall see sedatives, but they can cause toxicity to the elder people because it is taken for the improvement of sleep. So you just remind me, we call it as a drug automatism. So phenobarbital has that one more bigger adverse effect, that is called as a drug automatism. You just remind me, you can ask me the question at that time. Then next is a primidone. It is again barbiturate analog. It can be used in focal, that is focal to bilateral tonic-clonic and generalized tonic-clonic seizures. It also induces CYP enzyme like CYP3A4, just like barbiturate, because it is analog and it is not nowadays commonly used. It was long back it was used. Then next drug are which are causing enhancement of the GABA, that is GABA enhancing drug, which can acting through various mechanisms. One is GABA uptake inhibition or GABA transaminase inhibition. I told you about this, what will happen. You know, I told you to just, and even during ANS also I told you that whatsoever adrenaline, noradrenaline related or sympathetic transmission figure is there, you remember it, because at many places these words will be coming. So what is uptake? We have seen there are uptake inhibitors in adrenaline, noradrenaline, like tricyclic antidepressant, and many such chemicals are there which are causing inhibition of guanethidine like agents. So they are causing inhibition of uptake, and therefore they increase the concentration in synapse is one thing. I told you example of cholinesterase enzyme, that when we block cholinesterase enzyme with neostigmine, physostigmine, then we causes increase in the acetylcholine concentration. Similarly, if we can inhibit, or MAO inhibitors we have seen earlier in case of adrenergic system, or COMT inhibitors we have seen. So when we inhibit these enzymes, metabolizing enzymes, then we can increase the concentration of that chemical in the synapse. So on the same way we are using, because we know that GABA is very important type of what we can say inhibitory kind of neurotransmitter, and therefore it is very useful to increase the inhibitory activities. So drugs are in that are tiagabine, that is used in focal epilepsies, whether the person is having awareness or having impairment in the awareness. This is metabolized by CYP3A and causing dizziness, somnolence, tremors. These are the activity. Then stiripentol is another drug that is used in generalized tonic-clonic seizure, including Dravet syndrome. It is one of the important drug in case of Dravet syndrome, which is typically more effective in that particular condition. It causes inhibition of CYP3A4 and 2C9. Then next is vigabatrin is useful in the focal one with impaired awareness. It is not as useful in case of in focal one with aware patient. Then it is used in infantile spasm, especially when it is caused by tuberous sclerosis. Tuber-like structures are formed into that brain portion. Side effects are, it can cause progressive and bilateral vision loss. This is a big side effect, it is there. Then glutamate receptor antagonist, that is AMP receptor antagonist, that is AMP is the this analog of this is the receptor where this AMP is acting. Then the drug is perampanel. It is used in case of focal epilepsies, and this focal epilepsies either for patients who are aware or who are not aware. Then it is metabolized by CYP3. Side effects are anxiety, confusion, imbalance, visual disturbances, aggressive behavior, suicidal thoughts. Then potassium channel modulators, that is they are acting on KCNQ2 to Q5 positive allosteric modulator. Positive means which increases, negative means decreases the activity. Allosteric means different site. We have seen allosteric earlier, example was benzodiazepine. So it is a positive allosteric modulator. So it is acting on the GABA receptor and it causes increase in the activity of GABA receptor. or it increases the binding of GABA to GABA receptor. So we call it as a positive allosteric modulator. Okay, negative means they will bind to different side than the agonist, but they will cause a sort of, it is non-competitive inhibitor. So they will cause it as they are acting at a different place, but they will decrease the binding and therefore there will be reduction in the activity. So example of this is ezogabine. It is used in focal epilepsies. Either a patient is aware or it is not aware. Side effects are blue pigmentation of skin and lips. We call it as cyanosis because of the hypoxic conditions, decrease in the blood supply, dizziness, somnolence, fatigue, vertigo, tremor, attention disruption, memory impairment, retinal abnormalities, that is visual problems, urinary retention and QT prolongation. These are various adverse effects this can cause. Then the drug which is acting on synaptic vesicle, that is 2S, it is modulator. We know the importance of synaptic vesicles, that is they are storing the neurotransmitters and they are releasing it in the synapse. So if we modulate it, then we can alter this increase or decrease. If it is a inhibitor neurotransmitter, if we increase, then there will be more inhibition, and if it is excitatory, we can reduce the, or we can decrease the exocytosis of this, and we can increase the this refractory period. So levetiracetam can be used in many conditions like focal epilepsies, either patient is aware or not aware, and it can be used in case of generalized seizures like myoclonic generalized seizure and tonic-clonic generalized seizure. Side effects like somnolence, asthenia, ataxia, dizziness, mood changes, these are various adverse effects. Similar drug is there, one more, that is levetiracetam is there. It is also used in case of somnolence, is uncomfortable situation. Patient because of that it becomes more sleepy. Lennox-Gastaut syndrome. So these are only 4 or 5 drugs which are useful in that condition. Apart from that, topiramate is very good in case of focal epilepsies, that is either patient is aware about it or not, or whether there is impairment in awareness. Then it is used in case of generalized epilepsies, that is tonic and clonic. Side effects are again somnolence, fatigue, cognitive impairment. Cognitive impairment means will not able to understand the things properly or respond to the stimuli. We call it as a cognizance. That is, when I am asking you the question and if somebody is replying to it, that means cognizance of it. Okay, they are understanding it. My question goes to their mind, then they can think over it and they can find the best information they are having with. So this is called as a cognition. If it is not happening, then we call it as a cognitive impairment, that either they do not understand the question or they cannot reply it in proper way. So it can be called as a cognitive impairment. That is a learning difficulty. That is called as a cognitive impairment. Then next is valproate. It is very we can say that way very broad activity. It is having almost most of the type of epilepsy it is used as. Only biggest problem is it is affecting the fetus, and therefore should not be used. It is used in case of focal this one focal epilepsies, where either patient is aware about the environment or the nearby situation, or there is impairment in the awareness. Also it is used in case of focal to bilateral. Focal means only one point is there in brain, to what we call as a focal, while focal to bilateral, that means from one particular space to both side of the brain, that is bilateral, tonic, clonic. Then it is also used in generalized epilepsies like absence seizures, myoclonic seizures, then tonic and clonic type of seizures. So in all different kind of seizures, valproate is used. Side effects are, it causes transient gastrointestinal syndromes, that is upset of GIT, constipation, diarrhea and GI irritability. These are various gastrointestinal, nausea, vomiting. So these are various symptoms which are related to GI tract. Sedations, that is sleepiness or drowsiness, it is causing ataxia, that is muscle incoordination, tremor. Tremor means shaky movements are there, हाथ पैर हिलते बूढ़े आदमी के वैसे. These are tremors. Hepatitis it can cause, which is rare but it is dangerous one, so care to be taken in that. And one more bigger problem it is having, that is it is not safe for the fetus. If it is given during pregnancy, then it can affect the fetus too much, and therefore it is not recommended in any condition. Even though it is at many places or in many kind of epilepsies, it is a first line of treatment. It is the first choice of treatment, but it is not advised in the females in the childbearing age. Or if it has to be given, then the female patient, they have to be warned that till this drug is being treated, and at least 3 months after that there should not be pregnancy. Okay, because by that time at least 3 months period should be given. We call it as a wash off period, that is the drug is removed from the body completely. Till that period they should not plan for any pregnancy. So this is the thing about valproate. So these are various drugs, so many drugs. I hope you will understand it. Almost 30-40 drugs are there. So all these drugs you should be aware about it. Mechanism wise we have already studied. Not 30-40, I think it is hardly about 20 drugs are there. So all these drugs you must be going through. If you have any difficulty, you can ask me. I'll suggest you to make big table, just like table you can make. You add few more things in that. Pharmacokinetic features you add, absorption related, distribution, that is whether there is a protein binding or not. So drug wise same table, name of drug. Here above that one basic mechanism is given, that is sodium channel modulators. So in that drug number 1, suppose whatsoever drugs are there, phenytoin, carbamazepine, then add more thing is pharmacokinetics. In that you make 4 columns: absorption, distribution, metabolism, excretion. So you add this, then go for already mechanism we have. Then what are the indications, what are the toxicities and dose. So whole pharmacology will be in a table thing, and it will be easy for you to remember or write it down. And see that whenever question is asked, then you should have the ability. Many times question can be asked if it is a offline paper, then questions can be, I write pharmacology of phenytoin for 10 marks. Then you should be able to elaborate what is sodium channel modulation, what it is, what are the pharmacokinetics like absorption, distribution, metabolism. When you elaborate it from the graph, all of you'll find that at least good number of lines are available for that. Then what is the effect on various part of tissue, if you know, because we have seen phenytoin can also act on heart, phenytoin can also reduce the heart rate. So all this activity we should be able to mention. So various activity at various places. Then next is what are the effects, what are the dose, okay, and what are the adverse effects. So if we make this kind of chart of pharmacology, it will be easy for you to remember. You try to do this and you can put it on our group. This is sort of the homework you have. Now those who are interested to study higher than this, you can attend the class after this, that is around 3:10 it will be starting. I'll send you the link. If you are interested, you write it down in the group. So what you can do there is, because there also epilepsy is there, then you will understand what is the difference between this therapeutics, what we are doing here. So far we have conducted one class of it, that is how various which drug are the first line treatment or second line treatment of different kind of epilepsies. In pharmacology we are going by drug, while in therapeutics we are going by the disease or the subtype of the diseases, and in each disease which is the drug which is the best for that, which is drug which is to be avoided or should not be given. So this is good information you can add up into your table, that should be given during this, should not be given during this, okay. So this is how you can study. If you have any difficulty, you can ask me. You can put it there. Put the difficulties either in chat box or on our WhatsApp group. So go through this, read this, and if you are again interested to attend it, you can attend. Okay, I'll send it. You write in our group, those who are interested. Around 3:10 or 3:15 the next class will be starting. Then we'll be able to start it. Okay.